Have you ever looked at your pregnancy scan report and felt confused by all those medical terms? A lot of women receive their ultrasound reports, glance through it, and honestly, it looks like a bunch of numbers and unfamiliar words. But here is the truth: your obstetric ultrasound report is not meant to confuse you or scare you. It is simply a medical way of documenting how your baby is growing and how the pregnancy is progressing. And one very important thing to understand is this: your scan report is not the same throughout the pregnancy. What is written in your first trimester scan will be different from what is written in your second trimester and your third trimester scans. Hi, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. In today's video, I am going to be breaking down your obstetric scan report to you in a very simple way, trimester by trimester, so you know exactly what to expect. For first trimester, which is between 0 to 13 weeks, this is the early stage of the pregnancy, and at this point, the focus is mainly on confirming the pregnancy and checking viability. So what do we usually see in the reports? First, you may see something called gestational sac. This is the first structure we see in early pregnancy. It confirms that the pregnancy is present. It is what houses the baby in the womb. The next is the yolk sac. This structure helps support the baby in the very early stages before the placenta develops. The baby gets nutrients from it. Then you may also see something called the fetal pole. This is the early form of the baby. One very important measurement here is the CRL, which means crown rump length. This is what we accurately use to date the pregnancy. You will also see cardiac activity, which simply means that the baby's heartbeat is present. Sometimes the report may include the fetal heart rate. This is the number of heartbeats per minute, and it helps assess if the heartbeat is within normal range for the gestational age. The report may also mention the number of the fetuses, for example, single pregnancy or twin pregnancy or triplets as the case may be. It will also mention the location of the pregnancy to confirm that it is inside the uterus, that's the womb, and not ectopic. You may also see words like intrauterine pregnancy or IUP. This simply means that the pregnancy is correctly located inside the uterus. In some cases, the report may mention something like subchorionic hemorrhage. This is a small collection of blood around the pregnancy. And while it sounds scary, it is quite common and often resolves on its own. Now, this part is very important. At this stage, do not expect to see full baby measurements or detailed anatomy. It is simply too early. For second trimester report or anomaly scan, this is the most detailed scan in pregnancy. At this stage, your baby is more developed, so we can assess the structure of the body. Your report will now include fetal anatomy such as brain, spine, heart, stomach, kidney, limbs. Sometimes you may see no obvious structural abnormality. This means that based on what is visible, everything appears normal. Next is placenta location. You may see terms like anterior, posterior, fundal, or low-lying. Anterior placenta means the placenta is attached to the front of your uterus towards your abdomen. Posterior placenta means it is attached to the back of the uterine wall towards your spine. Fundal placenta means it is at the top of the uterus. Low-lying placenta means it is close to the cervix and may need follow-up. The next is the amniotic fluid. This is the fluid surrounding your baby. You may see terms like adequate, that's the normal amount. You may also see terms like reduced or oligohydramnios, that means low fluid. You may also see terms like increased or polyhydramnios, that is excess fluid. Next, you may see things like BPD, HC, FL, AC. This simply means the fetal biometry. They are the baby's measurements. We measure the BPD, which is biparietal diameter, that's the width of the baby's head. We also measure the HC, which is the head circumference. We also measure the AC, which is abdominal circumference. We also measure the FL, which means femoral length. This is the length of the thigh bone. These measurements are used to estimate gestational age, monitor growth, calculate estimated fetal weight. Estimated fetal weight gives an idea of how big the baby is, but it is still an estimate, not exact. And we have the gender, if it is visible and if the parents want to know. XX represents female, XY represents male. This scan is very important because it checks for structural abnormalities. For third trimester, the focus shifts. We could still have the details of the second trimester and additional information. At this stage, we are less concerned about structure and more concerned about how the baby is doing. Your report may include fetal lie. This refers to how the baby is positioned in relation to your uterus. Longitudinal lie means the baby is lying vertically, head up or head down. This is the normal lie. Transverse lie means the baby is lying sideways. Oblique lie means the baby is at an angle. Then we also have fetal presentation. This is different from lie. Presentation refers to the part of the baby that is closest to the birth canal or the cervix. Cephalic presentation means the baby's head is down. That is the ideal position for delivery. Breech presentation means the baby's buttocks or feet are down. That is what is closest to the cervix. So remember, lie is how the baby is lying. Presentation is what part of the baby is coming first. We also have fetal position, but you rarely see this in reports, but it describes the orientation of the baby's head. For example, we have occipito anterior, that is facing backwards. We also have occipito posterior, that is facing your abdomen. We also have estimated fetal weight in kilograms, and we also have amniotic fluid level, often measured using AFI, that is amniotic fluid index, or deepest vertical pocket in volume. We also report placenta maturity and location. You may see grading like grade 0, 1, 2, or 3. This reflects how mature the placenta is as the pregnancy progresses. The next is the cervical length. In some cases, this helps assess the risks of preterm delivery. Finally, the report could include Doppler studies. In rare cases, this checks for blood flow between you and your baby, especially if there's a concern about growth. Some reports include biophysical profile, which is a more detailed check of the baby's well-being, especially if your doctor is concerned about growth or risk factors. Biophysical profile looks at 5 key aspects. Usually it is scored from 0 to 2 points each. It looks at fetal breathing movement, that is your baby practicing breathing in the womb. It looks at fetal movement, that is, are there normal body fetal movements. It looks at fetal tone, is your baby flexing and extending its limbs normally. It also looks at amniotic fluid volume, that is there enough fluid around the baby, the one that is popularly called water. It also includes non-stress test, that is, does the baby's heart respond to movement. It is usually scored over 10. 8 over 10 is normal, 10 over 10 is normal, 6 over 10 may need closer follow-up, 4 over 10 indicates possible distress and your doctor may need to take action. But physical profile is not done in every routine third trimester scan. It is typically done when there is a concern like reduced movement, high risk pregnancy, or growth restriction. The important thing to know is that not every scan report contains all these details. These findings or your report details depends on the stage of the pregnancy, the reason for the scan, the hospital or diagnostic center. Some diagnostic centers or hospitals are more detailed than some others. So if you find your report very scanty or very shallow without proper explanation, you may need to have a repeat scan somewhere else. Finally, your ultrasound report is not something to be scared of. It is simply a tool to monitor your baby's growth and well-being throughout the pregnancy. So instead of feeling overwhelmed when you see those medical terms, you can now understand what they mean and what stage of pregnancy they apply to. And always remember, if you are ever unsure about anything in your reports, please speak up. If you found this video helpful, don't forget to like, share, and subscribe for more simple explanations on ultrasound and your health. And I'll see you in my next video. Bye-bye.